patients who have come in here and their last words before we put a breathing tube in are they didn't realize it was as bad as it was. They thought they were doing what they could do to protect themselves. We've had several people come in here and be very sick that all they did was want to see their grandparents. I'm a grandparent. I would like to see my grandchildren. This is larger than that. By wearing a mask, you're protecting them as well as yourself. Please, if you do nothing else, please start wearing masks. Thank you.
An impassioned plea from our frontline healthcare workers for all of us to protect ourselves and others with proper face coverings. Wear a mask, he said. During this obvious now third peak of the coronavirus in our country, more than 65,000 new cases added just yesterday. So far, more than 8.2 million Americans have been infected and more than 221,000 people have been lost to the virus in the United States of America. Over the last 2 weeks, 43 states and Washington, D.C. have seen a percentage increase in cases. The biggest spike is happening in New Mexico, where cases have increased a whopping 126%, and experts fear an upcoming spike in hospitalizations and dramatic staff shortages there. Joining us, MSNBC medical contributor and former director of health policy for the Obama White House, Dr. Kavita Patel. I mean, look, I sometimes want to squeeze information out of you and the other scientists and doctors to help inform my own decisions about whether to see my parents, but just listening to the frontline healthcare worker feel moved to tears that he's making this sacrifice. He has access to testing, but he's not seeing his grandchildren. It really underscores how uneven the sacrifice is. The people that don't believe in social distancing and don't believe in mask wearing are not making the sacrifices, and it's costing lives.
Yeah, Nicole, you're touching on kind of something that's so universal for many of us, not just in healthcare, but I think so many Americans, to your point, that are struggling with these decisions. And honestly, it's so hard, Nicole, when you see kind of, the president, patient zero for misinformation himself, who's making this kind of masks being political or not being necessary commentary. So it is troubling. And just as a kind of a point of context, the numbers of cases we're seeing are reminiscent, Nicole, of what we saw around July 4th, where you'll recall we were looking at, 60 to 80,000 cases a day. And they're also unfortunately reminiscent of the trends we saw in March and April when we had the really kind of horrible experience and had to do that national lockdown. We do not need to do that if we can all follow those simple, basic rules that you've heard now from so many of us and you saw in a very impassioned way, but it should be reinforced. We're going into Thanksgiving, into the holiday season. We're all tired and we're tempted and we want to touch our loved ones, but we need to protect them and ourselves.
And I know you've got a piece out on the disinformation, but it seems that we can't even get back to ground level. It seems that Donald Trump has brought this whole thing so low, so underground. He literally attacked Joe Biden for saying he would listen to Tony Fauci. That was a political attack against Joe Biden 14 days before an election. And Tony Fauci has been tossed around like chum in the water for the last 48 hours by Donald Trump. I mean, how do we even get back to sort of ground level before we can start really trying to eradicate this virus and get our cases where Tony Fauci says they should be around 10,000 a day?
I think the best way to get back to ground level, to your point, is to actually put into place some sort of national clear strategy. I mean, just let's imagine the counterfactual, Nicole. We've seen the misinformation. We've seen the damage the lies can do. Imagine the kind of clear messaging that just said, this is what we need to do. You don't even have to say that it's a national mask mandate. Just say, we are going to make masks available everywhere. They will be free. You will get what the U.S. Postal Service was going to do. We'll put them in the mail. You don't even have to think about it. And if you need one, it's there for you. We want to make it as easy as possible for you to make all of these things we're asking you to do easy. We will support schools for protocols. We will support small businesses so they can survive and that you can look forward to seeing them again. That's the way we do this. That's the way we bring it back to kind of some sense of normalcy. And that's possible. That's within reach, Nicole. This isn't hypothetical. We could have done that months ago. So now you replace that messaging with these dire requests. I'm all of us in almost tears and hope that it has influence. But it is possible, and I look forward to that day where the message is clear and the actions are consistent from the leadership to the front lines.
Such an amazing, amazing state of our country's conversation. Dr. Kavita Patel, thank you so much for spending some time with us on it. When we return, as we do every day, remembering lives well lived.